The human eye it's a biological marvel, right? A super complex window to the world. But for all that complexity, it is incredibly fragile. Today, we're going to explore exactly what happens when that window is threatened by a serious injury.
So, what really happens when the eye takes a hit, or gets pierced, or maybe worst of all, gets splashed with a dangerous chemical? Well, the answer isn't simple, because the type of injury kicks off a cascade of very different and very serious consequences.
All right, first up, let's talk about blunt trauma. Think about getting hit by a fist or a ball. This is what happens when the eye is struck by something, but the wall of the eye itself, what we call the globe, isn't actually broken open. And this right here is the first crucial distinction you have to make in eye injuries. On one side, you've got blunt trauma, which causes a closed globe injury. That means the eye structure is still intact. This is totally different from an open globe injury where the wall of the eye has actually been breached. So let's start by focusing on those closed globe injuries.
Now, even in a closed globe injury, the damage can be pretty significant. A really common one is a corneal abrasion, which is basically a scratch on the cornea. And if you've ever gotten a tiny bit of sand or even an eyelash in your eye, you know how painful this can be. In a clinic, a doctor will diagnose this using a special dye called fluorescein. It actually glows under a blue light and shows them the exact size and spot of the scratch. So what happens after that first scratch? Well, this quote points to a really painful complication. A simple abrasion can sometimes lead to what's called recurrent corneal erosion. See, what happens is the new surface cells don't heal quite right. They don't stick firmly to the layer underneath. The result? You get that sharp, recurring pain, and it often hits you first thing in the morning, when your eyelid literally rips those loose cells away as you wake up. Ouch. Okay, moving up in severity now. Significant blunt trauma can cause a hyphema. This is when you get bleeding in the anterior chamber. That's the fluid-filled space right between the clear cornea and the colored part, the iris. As you can probably guess, having blood pool in there is a very serious problem. This is way more than just a black eye. It can cause a dangerous spike in eye pressure, kind of like glaucoma, and it can even stain the cornea with blood, which might take years to clear up. So now we're going to shift from injuries where the eye is intact to something much, much more severe, penetrating trauma. We're talking about open globe injuries now, where an object, whether it's something sharp or a high-speed projectile, actually breaks right through the wall of the eye. And once that globe is breached, a truly devastating chain reaction can happen. I mean, a single perforation can tear through the cornea, it can damage the iris, it can rupture the lens and cause a traumatic cataract, then it can lead to bleeding in the vitreous gel that fills the eye, and ultimately it can cause the retina itself to detach. It's just a cascade of catastrophic failures, one after the other. But what if the thing that penetrates the eye doesn't come back out? Well, that creates a scenario we call an intraocular foreign body, or IOFB for short. And let me be clear, this is an absolute emergency. Not only can the object itself cause ongoing physical damage as it moves around, but it also brings bacteria and contaminants deep inside what's supposed to be a completely sterile environment. An IOFB can end up pretty much anywhere inside the eye. As you can see here, it can get lodged in the anterior chamber, tangled up in the iris, stuck inside the lens, or it could be floating around in the vitreous humor before settling on the super delicate retina. And each one of those locations presents its own unique and massive challenges for removal. All right, finally, let's look at a type of trauma that doesn't involve any mechanical force at all, but is one of the most urgent of all eye emergencies: chemical burns. The second chemical splashes into the eye, the clock starts ticking immediately. It is absolutely vital to understand that not all chemical burns are the same. Look, acid burns are definitely serious, no doubt, but alkali burns are often far, far more destructive. Alkalis, which you can find in common products like drain cleaners or cement, they rapidly penetrate deep into the eye. They cause this process called liquefaction necrosis, which means they literally start to dissolve and melt the tissue. This table, the Roper-Hall classification, gives us a really stark look at the prognosis. You see in grade I, the cornea is clear, prognosis is excellent. But as you go down the grades, you can see the cornea gets hazy, then opaque. And pay attention to that limbal ischemia column. That's talking about damage to the blood vessels at the edge of the cornea. By the time you get to grade 4, with an opaque cornea and more than half the limbus damaged, the visual prognosis is, well, it's 4. And this quote right here, this underlines the absolute urgency. In a chemical burn, the single most important action is immediate, massive irrigation with water or saline.
You don't ask questions. You don't examine the eye. You wash it out. Every single second of delay allows that chemical to do more irreversible damage.
And if that initial burn isn't managed perfectly, the long-term devastation can be just profound. This is simple pharon. It's a late-stage complication where severe scarring essentially fuses the eyelid to the eyeball. It's a painful, debilitating outcome that really just underscores the destructive power of these chemical burns. So, from a simple scratch to a catastrophic chemical burn, ocular trauma poses a massive threat to our most precious sense. The stakes are just incredibly high with any serious injury to the eye.
So, what are the big takeaways here? First, knowing the vital difference between a blunt, closed globe injury and a penetrating, open globe one. Second, recognizing that chemical burns, especially from alkalis, are a time-critical emergency where immediate irrigation is absolutely everything. And finally, that across all of these injuries, the single biggest factor for a good outcome is getting immediate, expert medical care.
Which brings us to our last thought. We've seen just how delicate the eye is and how devastating these injuries can be. So it's really worth asking yourself, whether it's putting on safety glasses for a project at home or handling chemicals with care, are you doing enough to protect your sight?